Welcome to the Stay Healthy El Paso podcast, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. This podcast is presented to you by Dr. David Midoff, expert physical therapist and owner of El Paso Manual Physical Therapy. It is our goal and intentions to provide you with valuable tips and insights from experts in the El Paso area so you too can stay healthy, fit, and energized. Now here's your host, Dr. David.
Hey, welcome to the Stay Healthy El Paso podcast. I'm your host, Dr. David Midoff, specialist physical therapist over at El Paso Manual Physical Therapy. I'll be talking to you today about the 3 big signs that you've got a tension headache. We see people here at El Paso Manual Physical Therapy for tension headaches consistently. I wouldn't say it's the most common problem that we see here in the clinic, but we get at least one every month or 2 at most, and they get better. Now, let me just differentiate the different types of headaches, and let's talk about migraines briefly for a moment, because I'm talking about specifically a tension headache. And a lot of people out there will, that have headache or migraine problems, they'll start Googling information and try to tease out what's a headache, what's a migraine, do I have, this type of headache or that type of headache, because there's all kinds. But what I want to just highlight here today is a tension headache. Now, a migraine is usually related to some sort of hormonal problem. It could be a nutritional problem, a hydration problem. It's usually something that we call physiological rather than mechanical. To pit the two against each other, physiological is like the cells that are inside the body, the blood flow, the fluids that are inside the body, the chemicals inside the body, and how they all interact and work with each other. Versus mechanical is joints and muscles and nerves and how all those things move together. So when we're talking about a tension headache, I'm talking about a mechanical headache. So the top 3 signs that you've got a tension headache, or AKA a mechanical headache, is the number one sign that everybody talks about is pain on the outside of your head. I'm talking on the top of the head. It could be on the sides of the head, on the forehead. Some people come in saying my scalp is tender on the top of my head. Some people only have one-sided head pain, it'll only hurt on the right or only on the left. That's very common. Or they'll say that it hurts on their forehead or right above their ear on one side. And some people just have pain on the back side of the head, kind of on the back half or back third of the head, kind of like right where your head would rest on a pillow if you were to lie face up on a bed or a pillow. And so pain anywhere around there is one of the common signs, as opposed to other headaches can create pain kind of deeper in the head, not necessarily on the outer surface of the head. Some headaches can cause pain behind the eye or face pain as well, like around your nose and jaw. That's a different type of headache. So I'm talking about a tension headache, and we're discussing pain on the top of the head, the sides of the head above the ears, the back of the head, and on the forehead as well. Now, the reason for this is because when you've got a tension headache, there's certain nerves that can get pinched that innervate the top of your head, on the outermost superficial part of your head, along the scalp, pretty much. So that's where you're most likely to get all the pain sensations. So number 2 most common sign is stiffness, tightness, and it's usually pretty strong at the base of the neck, right behind the head, kind of on the bottom part of the head, right where the skull meets the neck, the uppermost part of the neck. People usually will reach back there and they'll start digging on the muscles behind the upper part of their neck, and they'll say it's just tight there all the time. It just feels hard and tight, and I can't turn my head all the way because it's so tight back there. There's some muscles right there called the suboccipital muscles, and those muscles control the base of the skull against the top 2 vertebrae in the spine up there. Those muscles can spasm, they can get shortened, they can overwork, or a combination of those 3 things, and begin to not allow the joint where the skull connects to the first bone to move properly. And guess what? There's some nerves that come out right at that level that innervate the scalp. So that's why you can get pain into the scalp and all the way to the front of the head and along the sides of the head because of those nerves. It's usually the C2 nerve branches if you want to look that up. But anyways, that tightness that people feel in the back of their head or the back of the neck, kind of right under the back of the head, is the second most common sign. The third most common sign of a tension headache is burning, achiness, stiffness, and pain that can go into the neck and shoulders, like lower into the neck, the middle of the neck and into the base of the neck at the bottom, and all the way into the upper part of the shoulders. The upper trap region is what we call it, kind of between your shoulders and neck area. And then even into the upper back and on the back of the shoulder blades and into the upper back. The muscles that are in that region often get affected with these tension headaches, and they'll feel it. They'll let you know. Commonly, people can't turn all the way. They can turn better to one side versus the other. So, if they're looking to their right, it may not turn as well when they turn their head that way, but the left's better. Or sometimes both sides are very limited. People usually just say that they feel pain, tenderness, stiffness, achiness, and oftentimes burning is a symptom that people tell us about whenever they've got these tension headaches. Now, let's talk about treatment options for tension headaches. By far, the most common treatment option that people will start on their own is over-the-counter pain medication. They'll go to Walgreens, CVS, anywhere where they have medications, a grocery store, and they'll buy their over-the-counter Tylenol if it's something a little stronger that they want, ibuprofen, Aleve, etc., and those kinds of things. And pharmaceutical companies are so smart because they know that headaches affect so many people and that it's just so simple to go take medication. They have come out with specific medications for headaches. And usually, people will have some sort of a sleeping aid along with this. Then they put the two medications together in one so that they can kind of knock themselves out and also feel better. So you can try that over the counter, or a lot of people try that over the counter, and it's effective for a short term. It really is just a short term solution. It masks the pain for a bit so that you can kind of get through the day or get through a few days if you need to. But I highly encourage you to use caution and be careful when taking medications because of the side effects and those medications. If you read the labels, you're not supposed to use them for more than a few days at a time. You need to eventually talk to your doctor. It's not a good idea to rely on an over-the-counter pain medication for the long term for this type of problem, for a tension headache. So you've got to make sure that you are careful about how you're using your medications. Now, then some people will go to the doctor if the over-the-counter pain medications don't work because they want a stronger prescription strength medication, and doctors, of course, that's their bread and butter. They are great at handing out medications, and it's very helpful for a lot of people. But it's the same idea. You're still taking a medication. It's only going to give you short-term relief. In this case, hopefully it lasts a few days or a week, and the doctor, of course, is considering your overall health in the process. So you've got to figure that out for yourself if you want to be on prescription strength medications. Another option that doctors will give you for tension headaches is a lot of doctors recognize that the source of the problem is usually at the base of the skull where it connects to that first vertebrae. So sometimes they'll do injections into that area. They'll do a pain injection directly in that area, and it can be pretty relieving for most people. But again, it's short-lived. It'll only last for a month, sometimes a few months at most. But there's usually some underlying problem that sets up that joint to become stiff and the muscles to become overactive and the nerves to get pinched in the area. And injections or medications just don't fix that. They don't address stiffness and strength. They alleviate pain. They turn off the pain signals coming from that part of the body so that you can continue through your day. So it's short-lived relief. And another common treatment is chiropractic, and it's pretty effective. If you have ever visited a chiropractor, of course, you know that they like to pop and snap joints. That's their bread and butter. That's what they've gone to school for and have done for a long time, and they're usually extremely good at it. And if you've got stiff joints up in your neck, they are probably going to be excellent to free it up. And they can definitely relieve the problem for the short term again, because what has to be factored in is the strength of the muscles around the neck joints, the upper neck joints, so that joint can remain free for the long term. Because it is possible to, on your own, have good mobility in your neck joints and have excellent strength in your neck bone, in your neck muscles, and be able to live free of having tension headaches over and over again. It's not necessary to rely on somebody to help you out. But chiropractic is a great place to start. Of course, it's natural. It doesn't involve any sort of medications or injections. So I definitely think that it's a good place to go. But what chiropractors just usually aren't good at doing is prescribing the right kind of exercise, because that's not their training. That's not what they usually do. So consider that if you've gone to a chiropractor and you've experienced the relief that they can provide for this kind of a headache problem, but it keeps coming back, then maybe you need a little bit something more. And so that's when I go into this final recommendation that I make for tension headaches, and it would be physical therapy, specifically manual physical therapy, which is what we specialize in here at El Paso Manual Physical Therapy, of course. Now, the reason why I highly recommend this, I'm biased, of course, I'm a manual therapist myself, but seeing the results in people and seeing the long-term relief that people get, where they really aren't coming back for tension headaches over and over again because they're taught how to self-manage. We free up the joints here by hand, so we do some chiropractic-like maneuvers. Sometimes there's joint popping involved. It just depends on what the patient needs. In some cases, we find that the joint's actually moving okay, and it's not going to ever pop, because I don't know if you've been to the chiropractor and you've ever had the experience where they try to pop your neck and it didn't pop. Well, that's usually because the joint isn't really stuck, but you can still have that perception of stiffness in the area, and that's usually because there's muscles that are just grabbing in that area and they're not freeing up. And popping a joint or going through the technique to pop a joint can kind of free up the muscles, but it just doesn't do the same as going through some manual therapy treatment where we do specific massage techniques to free it up. But even then, I tell all my patients this whenever they come in for a tension headache: all the stuff that I've done by hand to you is only going to be short-lived unless you do your exercises. There's got to be accompanying exercises with a hands-on treatment plan so that the results the long-term results can begin to form, and you can know what to do on your own when this comes back, if it starts to come back. There's usually some sort of maintenance program that needs to be kept up, which most clients find easy to do, because especially if they have an exercise routine already, it's easy to say, hey, well, you're in the gym 3 times a week. Let's just make sure that you're doing these exercises when you go, and you're fine. You're going to be managing your headache problem so that it's not coming back over and over again. So it's not always got to be like a physical therapy, one of those goofy looking exercises with the rubber band. We hardly ever do that here in the clinic, because it needs to be something that you take home with you, that you can do at the gym, that you can do at the desk if you have a desk job, or at home if you're at home. It needs to be something that's easily transferable and that fits into your normal routine in life. So that is how we fix tension headache problems here in the clinic naturally. Most of the time, people don't need surgery for this. I can't think of a time, honestly, that anybody's ever had a surgery for a tension headache specifically. If a tension headache problem continues over time, people will usually end up in pain management, or they'll have an associated neck arthritis condition, and they may end up having surgery for the neck arthritis. So it's usually a bunch of problems that all kind of stack on each other, and then there's one that is surgical that the surgeon might operate on, but there's still other problems that need to be addressed. And so I highly recommend clients get problems addressed right when they happen, so that they're not seeing extra healthcare professionals and possibly having unnecessary treatments that they could have avoided. But we help people with that all the time, and they get better. They get tremendously better. Their clarity comes back from, they can think clearly. They're not having to worry about taking pain medications every day, especially as the day goes on, it tends to get worse. They can sleep well at night. A lot of people have pain right when they go to bed. They can't get comfortable, and then they get woken up at night from their tension headache problem, and then they're just grumpy. That's one of the, I think, hidden symptoms that people don't talk about a lot. But I ask all our clients, I tell them, because I'm a big proponent of no medications, no injections, and avoid surgery if you can, but there's times when it's necessary and appropriate. And whenever I get a tension headache client coming in here, one of the things I have to ask them is do you have any family at home that you live with? And most of the time people say yes. And then I ask them, when your headache symptoms are really bad, do you think you could be nicer to them at times? And most of the time people sheepishly say, yeah, I'm grumpy at times. And I tell them it's okay. That's normal. You're in pain. It happens to everybody. You're going to start, they're here in the clinic usually, so I tell them you're likely going to start working with us, and this is going to get cleared up, so it's not going to be a thing here in a few months at most. But in the meantime, if you're at home with all the family and you're in pain, maybe take some medication so that you're nice to them and your relationships can be great. So those are times that you might consider getting some medication or talking to your doctor about an injection or medication. You have to look at life that way, because it's about quality of life, not just avoiding surgery and injections and medication, but you need to make sure that the people around you are happy and that you're happy around them too. So anyways, I hope that this podcast was helpful for you. I hope that you learned about tension headaches. And if you've got these signs or symptoms and you're in the El Paso region and you want to get in touch with us, the quickest way is to call us at 915-503-1314. Tell them that you heard this podcast and ask for a complimentary discovery visit. When you say those words, our people that answer the phone will know about what you're talking about, and they'll make sure to discount your discovery visit, which is a 20-minute visit to get assessed, to get checked out, and learn about what's going on, get a diagnosis for the problem, get a chance to ask questions, figure out all the details about what's involved in treating your tension headache problem with manual physical therapy. Another option is to go on our website and look for the discovery visit option on there. You can apply for a discovery visit and just mention that you heard about this on the podcast so that we can know to discount it always for you. Anyways, if you have any other questions, please reach out to us. We're happy to help, and I hope you have the best day. Bye-bye.
Thank you so much for listening to the Stay Healthy El Paso podcast, brought to you by El Paso Manual Physical Therapy, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. If you'd like to learn more about what El Paso Manual Physical Therapy can do for you, call 915-503-1314 or visit our website at epmanualphysicaltherapy.com. Mention this podcast for a free discovery visit valued at $100. If you enjoyed what you've heard, please be sure to leave a review on iTunes and follow the show on your favorite listening platform so you won't miss an upcoming episode. Tune in next time to get the best health tips from experts in the El Paso area.